How's everybody doing? Can everybody hear me? Awesome. My name, so my daughter does go to school here, and there's no scholarship, so I pay a pretty good tuition, and it's nice to see that there's some really comfortable rooms that the money's going towards, right? I am at University of Colorado. I've been there for quite a bit. This is, you can keep it back, or, yeah. This is my first time presenting what I'm going to talk about. So just bear with me. It does say I'm a senior associate athletic director, but don't let the pink shirt fool you. I'm an athletic trainer. And I'm passionate about athletic training. I love it. There was a point in time where I realized that, you know, there was probably more I could do to help all of our student athletes versus just being in the role of a head football athletic trainer. And that's when I began my transition over to administration. For this particular presentation, I think it's important to understand a little bit more about me, because hopefully it'll all tie in and make sense as I get towards the middle and end of my presentation. But you know, I grew up in San Francisco. My dad, first generation U.S. citizen from Nicaragua. His mom was from Nicaragua, and when she got pregnant with him, it was her second pregnancy without being married. So it was time for her to find a new place. So she left her village, and it was in the 40s, so right around World War II. There was, in San Francisco, they were looking for people to help in the shipyards, and she found her way up to San Francisco. My mom, big Irish family, probably second generation U.S. citizen, and my grandfather was like an Irish cop, motorcycle cop in San Francisco. Half Irish, half Nicaraguan. I have an older brother, Kevin Francis. I'm Miguel Alejandro, he's Kevin Francis. He got the Irish name. My mom used to tell everybody she had a Kevin from heaven, Miguel from hell, right? Which I think, as I reflect on it, it really bugs me the more I think about it. Okay. So yeah, next slide. Like I said, I grew up in San Francisco. You know, I think I had a pretty strong feeling what my family thought about me, so I went far away from San Francisco to college. I went to Boston University. Those that are good with numbers may see that Miguel from hell ended up doing 5 years of undergrad. I was looking to see what I wanted to do. I was looking at PT program, a couple other programs, and I found athletic training, and it sounded awesome. Like everything that checked all the boxes for me. Then I went into the program, and I think sophomore year in the program, we had to work indoor track meets. I just ran into Buzz earlier, and Buzz, what do you think of indoor track meets? Right. So this was before there were hour limitations, right? We were working all weekend as student trainers in doing track meets. And I think finally, halfway through the year, what the fuck is this, right? But I wasn't gonna let it beat me. I wasn't gonna quit. It didn't make any sense to me. I didn't enjoy it, but I wasn't gonna quit. You know, I liked working in the training room with the athletes, but just covering events like that, I didn't particularly care for it. But I wasn't gonna let it get me to quit. So I stayed with it, graduated. The one thing I will say about not having hour requirements is it forces me as a student to really be better with my time. Thursday nights, Friday nights, I was in the library, which wasn't the case my freshman year, but I was in the library, I was getting things done, and you know, Saturday nights was my night to go out, but it forced me to I learned how to focus and get through, I think, the important things that were in my life. I met my wife in college. She played field hockey. Probably tale old as athletic training, where student athletic trainer marries an athlete. Field hockey, I don't know if that's a thing here in Texas. By far the worst sport ever to watch. It's terrible, but I was at all the games, and we're happily ever after. Left BU, worked at Holy Cross for a year, then had an opportunity to go to Fresno State. I did my graduate work at Fresno State for a couple years. Then went to Miami Dolphins for a year. It was Dan Marino, I think second to last year. Jimmy Johnson was the coach. A lot of fun. It was good. Left there. My wife was from Northern Virginia. I ended up at Towson University in Baltimore, Maryland. And then my mentor created a position at Fresno State that I stepped in and filled, head football guy. It was 2001. That was a great year. David Carr was our quarterback. We had a great season, number 8 in the country, some really good games. And then 9/11 happened, and I remember we ended up canceling the games for that weekend, and we ended up playing Boise State the following weekend. And again, number 8 in the country, ESPN game, and we lost to Boise State. Dan Hawkins was the coach. And anybody here from Boise? Boise State started off as a truck driving school. I don't know if anybody knows this. It was a 2-year truck driving school. Eventually became a 4-year institution, and then they had a good football team, and the rest is history. So shortly after that, summer of 2006, I'm in North Carolina. My in-laws have property in North Carolina, right on the beach. They set it aside for the family to go 4th of July week. We all gather, 5 or 6 bedrooms. You open the door, the pool's right there and the ocean's right there. It's fantastic. I had 3 little kids. Great thing, my phone rings, and there's a job opening at Colorado, and somehow my name got thrown into it. And I was asked if I was interested. I wasn't really sure, but I did the whole list of pros and cons, and the pros really outweighed the cons. And 3 days later, I'm in Colorado interviewing for the job. So this vacation, beach vacation, I didn't even pack underwear, right? Flip-flops and swimsuit the whole time. So I had to go shopping for my interview. I kept the price tags on everything, except the underwear. I wasn't going to return the underwear. Interviewed at Colorado and was offered the job that night. It was tough. Fresno was a great town, but it was tough. Next slide. Life in Colorado was fantastic. Kids were thriving. They opened a charter school 3 blocks from my house, K through 12. Kids got in it, and my wife is an occupational therapist, and she got the OT job there. So it was awesome. Sports, the kids were playing lacrosse, football, soccer, you name it. Really had a great time. It wasn't all perfect. The AD at the time was a used car salesman, right? He would say yes to you when you asked him for things and talked to him, but he would say yes to everybody. Certain time you got the feeling that somebody wasn't going to get what they wanted. Had a head coach that wanted to fire me. Now, it happens at this level. Wasn't that I did anything wrong. He just wanted to hire his friend in my position. And that was a tough time. I learned how to, I wasn't kind of like quitting athletic training when I was a student, as I was talking about. I wasn't going to let him beat me. I figured I needed to be the first one there, last one, work twice as hard as he did, and fortunately he wasn't a good coach. He was gone in a year, and I stayed, and I beat him. Next slide, please. Thank you. Then the wheels fell off the bus. In 2015, I was sitting there in my office. We had recruits in for the weekend, and then I was just noticing some, I all of a sudden had this sharp pain and pressure, and it's hard to describe. It was really in a place like between my scrotum and my rectum. Suddenly, underwear is not that taboo of a word, right? 42 years old, I reached, my physician was our family medicine doc, our team doc. I hadn't had a physical in a couple of years. I scheduled an appointment with him. And go in for my physical. And I knew, I think guys pay attention to this stuff. I wasn't supposed to have a prostate exam until I turned 50. At one point it was 45, and then they pushed it back to 50. And I remember when I turned 40, I was grateful they pushed it back to 50, right? So I go in for my physical, he says everything's fine, and then, he's looking at me, and I have a weird look on my face, and he's like, "What's wrong?" And I said, "I've had this pain and this pressure feeling," and he looked at me and he said, "Well, do you want me to check you? You're not supposed to be checked till you're 50. And no, I don't want you to check me, right? But, something was wrong." And then he said the 11 words that made everything all right. He said, "It's not going to be fun for me either." So, awesome. Checked me. He had some concerns. Perhaps I had prostatitis, put me on antibiotics, and scheduled an appointment with or referred me to a urologist. Finished the antibiotics. 2 weeks later, I see a urologist. I got blood work that day that I had my physical, and it came back that night. And I remember looking that night in bed. I was looking at my phone and at my blood results, and my PSA was 62. It's supposed to be 0 to 6 is normal range, right? For most healthy men, should be 1, maybe 2. And so that was a little weird, but prostatitis can raise your PSA. Went ahead and did the follow-up, did blood work before my follow-up with the urologist, sitting in my urologist's office. Comes across my phone, 93. My PSA went up to 93. 2 minutes later, the doc walks in and did a double take, looked at me. He said, "What are you doing in my office? You're too young to be in my office." "Perfect, I'll leave. Just tell me why my PSA is this high." It's amazing how many people go straight to the digital rectal exam, right? But here we go, he's checking me again. He's concerned and schedules a biopsy. Anybody have biopsy? Don't raise your hand. So I go for the biopsy. At this point, my wife comes with me, and I walk in the room. I'm a little unsure of what this is, but I walk in the room and I see a machine that doesn't look promising. And basically, the biopsy is an internal ultrasound, and there's like a gun attached to it. And there's 9 needles. The needles are about this long. Okay, and the idea is you use the ultrasound to find your way around the prostate, and you take 9 tissue samples. Squeeze the trigger, the needle goes in and out and pulls a piece of tissue with it. So I'm laying there and getting this procedure done, and my wife is rubbing the top of my head to calm me down. And I told him, one of you has to stop. So the doc wouldn't stop. My wife stopped. Like I said, I grew up in San Francisco. My mom, at this point in time, started having dementia. Miguel from hell brings my mom to Colorado to live with us. Kevin from heaven had nothing to do with this, didn't want anything to do with this. So we brought her in Colorado to live with us. Eventually she had to go to assisted living, but she had become like a hoarder, so my brother and I would fly regularly to San Francisco to work on her house, clean up her house. At this point, there was a time my wife and kids ended up flying out for a long weekend and joining us. And so we're all driving back to the airport. I'm driving, my brother's sitting next to me, my wife and kids are in the back, and my phone rings. And it's the hospital. And so I pick up the phone and I can still hear the words today. Miguel, it was the urologist. You have cancer and it's bad. I need to see you tomorrow, 10 a.m. my office. That was fine, we were flying back. Went to his office, stage 4 prostate cancer. So my situation, next slide. Jeez, here. Stage 4 prostate cancer. My situation was a little unique. My biopsy results showed that I had small cell prostate cancer, so a neuroendocrine cancer. 2% of everybody diagnosed with prostate cancer may have neuroendocrine cancer. In addition to the neuroendocrine prostate cancer, I have adenocarcinoma prostate cancer, your typical hormone-dependent prostate cancer. Of the 2% that get diagnosed with small cell prostate cancer, 2% of those people have both, like me. So I'm 2% of 2%. There is no cure at that time for small cell prostate cancer. I spent a couple of days doing scans and different blood work and all that. Turns out the cancer had also metastasized to my bladder, seminal vesicle, and surrounding lymph nodes. Again, something that's unique about me is most people that have METs, short for metastasize, in prostate cancer goes to bones. I have no bony METs. Mine were just soft tissue and organs. And so when we finished reviewing all the scans and stuff, because I'm 42 years old, I have a super aggressive diagnosis of this prostate cancer. My case went in front of the tumor board for the hospital. Tumor board is all the oncologists get together in a room like this and present a case, and everybody gives their input on how do you treat this. So this urologist told me, hey, you're going to go see, I had to drive to the hospital, an appointment in a couple hours. You're going to see a medical oncologist and a radiation oncologist. And they're going to give you treatment protocols. You have to add, the goal for me is to extend my life, right? This is a terminal diagnosis, there's no cure. The goal is to extend my life. So he said, you need to really ask them, what if they could say radiation is going to extend your life 8 months, ask them, what's your quality of life going to be? If the chemo is going to extend your life 6 months, ask them, you have to understand if it's worth it. With 6 months of feeling like crap, you make the decision if it's worth it. He said, if it were up to me, I would just enjoy the time I had left. It's kind of a fucked up statement, right? Life expectancy, 18 months. The worst thing anybody can do at this point in time is go on the internet and start looking at things like this. I did think, when you talk about life expectancy, that might be for most people that are diagnosed with prostate cancer are diagnosed in their 60s and 70s. So I was always wondering if I was kind of an outlier. Maybe that didn't apply to me. Next slide, please. So I did go up, meet with the radiation oncologist, medical oncologist, and they were talking about, well, we want to do radiation first, then chemo, no chemo, then radiation. I did fly to UCSF for a second opinion, and we decided to do radiation and then chemo. My radiation oncologist was insistent that they take my tissues from the biopsy and send it to Foundation Medicine in New England to get genetic testing on my tissues. Apparently this wasn't really a thing at the time. And they did find out that my tumor, not me, but my tumor had developed a BRCA2 mutation. Did radiation. I think I did 26 treatments, radiation treatments. You know, I was pretty healthy at the time. I was able to, you know, I was running a lot. I ran through all the radiation and all that. When I was done, I was supposed to get radioactive pellets implanted in my prostate. The prostate had responded really well and shrunk, so I was no longer a candidate for that. So then I went back for another 36 radiation treatments. And then, you know, I'm not sure if anybody's familiar with the radiation process. You go, you check in, and they give you a little, like a restaurant thing when you're waiting for your table, and then it starts lighting up and vibrating when it's your turn. You go back to the locker room, change into your gown, and I'm looking, and there's all these old men in tighty whities waiting, and then the phone rings. They say, okay, we want this patient in this room, and you go to your room, and I was in really good shape, and I was cocky, and I had a chip on my shoulder, and they called my name, walking down the hall. I don't even think I tied the gown right. And I turned the corner, and there's this 10-year-old girl. Beautiful, stuffed animals all around her. So sick. Sorry. It's really a crazy journey. That got me out of my cockiness. It was tough to see. And I realized how lucky I was to be who I was and the shape I was for my journey. My wife was really good about making sure the kids participated. Like my children participated. So when I went for radiation, they came in the room. The docs were fantastic. Showed them the machine, showed them where I was going to lay, how the machine worked, what was going to happen to me, and it was great. They didn't come to all the treatments, but they were at a few. That's my wife and I. When that was my port from chemo. I had it removed, and that was from then. And then if you hit the button, that was my last chemo treatment right there. So we included the kids and everything. We had to convince them that was okay to do. Next slide. So some thoughts at this point. When you hear the diagnosis, a diagnosis like this, you get introduced what I like to call to the dark, right? And the dark is a really weird place, and it's exactly what it sounds like. And but the more time you spend in the dark, you realize how complex it is. Sure, it's lonely, but it's not the absence of life, it's where meaning reveals itself, right? You start to learn what things really mean. You start to learn what life is really about. And I love the dark. It's meant a lot to me. And been very important in my journey. I think you need to really get through this, you need to be honest and vulnerable. You need to, there's plenty of people that come to you when they hear about this. You need to let them participate. We were never good at, we were always the one that did the meal trains, helping people. Something happened to someone in the neighborhood, we were the first ones there and doing all that. So to learn how to accept help was really tough. But when people want to help you, they want to give something of themselves to you in your journey, and that's a really cool thing. And if you don't let them participate, for your own reasons, you're not providing them an opportunity to participate in your journey, and that would be unfortunate. I also learned that in relationships, if you don't communicate well and you leave some blanks, people tend to fill in those blanks with their own thoughts, their own feelings, what makes sense to them, and that was kind of our what we thought a lot about with the kids. We had to be as honest as possible with the kids and tell them as much information as possible, so they didn't get too scared with their own thoughts and fill in those blanks with bad thoughts. I don't know if that was the right thing. So let's see. I think they were 12, 10, and 8. The youngest struggled the most. My wife would email all the teachers, and she was at their school, email all the teachers and tell them what we were going through as a family. And if any of the kids looked like they were struggling, just know this is what's happening. And so my youngest would end up in her office a couple times. Like if they did jump rope for heart at school, anything that reminded him of sick people, he struggled a little bit. And so he would come into her office. In this journey, you're constantly looking for information, looking for help. There's not a ton out there that resonates for me regarding cancer patients. Both of my boys are now in the military, so I know nothing about the military. I started listening to military podcasts, or I found the Sean Ryan podcast. I don't know if anybody here listens to Sean Ryan. And he had a guest on there. It was episode 102, Chad Rubichaw. And he said something, and often I hear a lot of these veterans talk about experiences through trauma, and it actually kind of resonates for me. By no means am I comparing myself to these veterans, but I think how you deal with trauma correlates. And he said, and I'm going to paraphrase, bad things don't take you to rock bottom. Your behavior and your reactions to bad things dictate your path. But he was talking about when he put a gun in his mouth. I took that, and how I interpreted that is, this bad thing happened to me, and I could shut everybody off in my life and be selfish, but that would take me somewhere that probably wasn't the best path for me. By having people participate in my life and in my treatment, I think that opened up some new paths for me that really, I'm in a really good place, and my history with this has been fantastic. I also had to learn how to be a patient. It's funny, as I was out in the hallway and I could see people coming out, answering cell phones, talking about how to expedite maybe athletes through care, get this done, get that done. I used to have radiologists call me right after a kid finished an MRI to give me a wet read on it, and I would be up in coach's office talking about things. I had to learn how to get a CT scan on Monday and find out my results on Friday. And we weren't talking about a meniscus tear, we were talking about, in my mind, life or death things, and that was really tough. And thank God I didn't go back to clinical athletic training after this, because I don't know that I would work well with demanding coaches, coming from, you know, what I kind of, my second life. This was the beginning of my second life. And I think one of the benefits of my journey is that I have a second life. You know, I come into this life as a teenager, though, so it's a little different. Next slide. I mean the attitude of a teenager. Obviously not a teenager, the attitude of a teenager. I did go back to work. So I finished all my scans, had my treatment set, and decided, you know, I need to go back to work. I was not that productive at work, but going to work was very beneficial for me. It gave me a sense of control. When you have, it's not like I smoked and I got lung cancer. I have no idea how I got this cancer. And so you, as a cancer patient, you feel like you have no control in life. Going to work gives you a sense of control. It did help me with resilience and coping. You know, you learn how to function on something or focus on something when you have this other thing going on in your life, and it improved my quality of life. I couldn't imagine sitting around the house and only just doing treatments and things like this. I talked about the dark earlier. You spend a lot of time in the dark, and I did realize some things happened when I went back to work that taught me some things. First, I realized I've never been a really good friend. And what I mean by that is I got a phone call from a friend, Alan Harden up at Texas, UT. We were working on a project together, and he was waiting. We were sending documents back and forth. And he was waiting for my edits to this document. And I was late with that, and he finally called me and said, where, I need this, where is it? And I had just come from the doctor's office, and I told him about my diagnosis. And he said to me, he said, hey, if you ever need to talk to someone, if you ever need to yell at someone, if you ever need to just cry, call me. He said, I love you. I've never had a grown man tell me that. You start thinking, you go through life and never experience that? What a terrible life. I realized I wasn't a good husband. I had a student trainer who was kind of a family friend. I hired her in the training room. And she asked about treatments. I said, I got all set. I'm gonna, you know, Andrea wants to take me to treatments, but if she takes me, I'm a patient. If I just go, then I'm running errands. I'm getting my dry cleaning. I'm running down the radiation. I'm coming back to work. I got this meeting, blah, blah, blah. And she stopped me and she said, you're scared. And she called me out. She was right. I was scared. And by being scared, I was willing to, those promises I made to her, those vows I said to her, I was willing not to honor them because I was just scared. I could have been a better husband. I wasn't a great dad. The first thing I asked myself when I was driving into work was, what the fuck have you been doing for 20 years? I've been focusing on everybody else's kids and not mine. I'm a good dad. I know I'm a good dad. I wasn't a great dad. And this gave me some perspective on how do I really focus time and attention where it needs to be. And I probably could have been a better ATC. When something bad happens to you and you see how people are there for you, could I have been present a little bit more for my athletes? Certainly could have. Certainly could have. I also realized that some of the things I went through made me more prepared for this journey. Dealing with that coach that wanted to fire me, right? understanding that my journey through athletic training taught me how some resilience and how to, work hard, and it prepared me for the attention I was going to need to give this next battle. Next slide. So as I went through this, everybody was talking to me as a cancer patient, and finally at some point you're like, I don't want to be known as a cancer patient. That's not my identity. So I had to pick finish lines. I had to find a way to do things to give myself a different identity. And, I think I finished my last chemo right before Christmas. And then this is Valentine's Day, I did the Austin Half Marathon. And then later in the spring, I did the Steamboat Full Marathon, which I thought was really cool because you start off at one altitude and you finish at a much lower altitude. What I didn't realize is it was a lot of this, right? But I did it. And then in the corner, that's Miguel from hell and Kevin from heaven right there. If you notice that picture, I finished the marathon, I changed, I got some food, and then my brother finished. Next slide. Also, just changed my life a little bit. It took the family. My goal was to put as many embarrassing pictures of my daughter as possible. We went skiing in Europe. We ended up in London. I bought a motorcycle. I love to ski, and for me, skiing is like flying down the mountain is the closest thing to flying, and it's a great feeling. And I remember when I was in the chemo chair, I heard a motorcycle go down the street, and I was like, that's it right there. And so I bought a motorcycle. It's nothing like skiing. There is, I got a lot of crap. People thought I was being reckless. Trust me, I don't want to die. I'm doing everything I can to stay alive. So I have the helmet, the body armor, the jacket, the boots with the bars in them, the jeans, and motorcycles are nothing like skiing. You just smell your own breath the whole time you're riding with that helmet on. And then when I was in high school, I was an exchange student. I lived in Turkey. I went back and visited my Turkish family. So my little sister got married. That's in Istanbul with my Turkish family. So I was really kind of redefining myself, living that second life. Next slide. There were some complications. There's always complications. I did, right before the Portland Marathon, my numbers started to increase, and that was a really terrible feeling because I was going to see my brother. We were going to go do this marathon, and all of a sudden I went back from being healthy to starting to die again. And didn't know what I could do. But ran the marathon, came back, and I talked with my oncologist. There was a new scan that was out. My hospital didn't have it, but there was a hospital in Chicago that Loyola that had it. Wouldn't accept my insurance. I had to pay cash for it. It was about $10,000 for the scan. And so my neighbors, one of them bought my plane ticket. The other one got my hotel room. They travel a lot, so miles and points. And again, it's just experiencing this feeling I hadn't really experienced before, people doing things and helping you. And it was great. So I was put on these new meds. The scan showed that there was one lymph node outside the original radiation zone that they missed. And so the cancer was still active there and then started to spread. And I was put on a new medication. That medication failed. It kind of screwed up my kidneys a little bit, so I have a problem with absorbing potassium. And so I'm on meds for that now too. And then cancer came back again. I found it in my neck. And my radiation oncologist had read about a small study that looked at women with ovarian cancer, and the med they were using for ovarian cancer was called a PARP inhibitor. And somebody thought, well, maybe it'll work well with men with hormone-dependent cancer, and because I had the BRCA2 mutation, they put me on this, and I've been on it ever since. So I think that's almost 6 years, almost 7 years. I think I'm the longest prostate cancer patient that has been on this PARP inhibitor. It's all because this one doctor decided to have my tissues tested, right? The genetic testing. I also learned this phrase that I say all the time now, so what, now what, right? I wasn't ready for that phrase when I first got diagnosed, but when I started getting some traction, bad things happen. Sure, we should process them, but we got to move forward. So what, now what? Next slide. I found that I had reinvented myself. I was living a great life, doing all kinds of things, but something was missing. And this is Malcolm, one of our football players. This is before I got sick, but you can see a horrific right knee injury, ACL, complete MCL rupture, lateral meniscus issues, and it was a tough rehab. And one of the things that we found with Malcolm is, we kept pushing motion, right? And so he bought himself a bike, and he was doing a ton of biking, and so for the MCL, and so he bought himself a bike, and all of a sudden this guy discovered things he'd never known before. He grew up in LA, and he started doing triathlons, started doing bike races, and I actually was competing in this, saying this is a triathlon. I was in this triathlon when Malcolm was, totally kicked his ass in the run, and he beat me in the bike. I beat him in swimming. He discovered, he reinvented himself after this knee injury. But nothing made Malcolm happier than when he returned to football and started playing again. Even though he had this new life and this new love for things, getting back to that sport and competing on the football field, he had the biggest smile. And I realized I was living my life outside of work one way, but in work I was not doing as much. And I was afraid. I was going to let people down. Next slide. So I did finally decide to immerse myself in the work aspect of life. And, the Pac-12 was really rolling, and I ended up being the vice chair of the medical group and chairing the medical group, and sure as heck, during that process COVID hit. And the Pac-12 medical group was really well organized. I was fully in administration at this point, so I couldn't do the athletic training things. But the role outside of COVID for the Pac-12 was probably about a 0.5 FTE, right, worth of work. And then once COVID hit, probably 0.75 to another full-time FTE. We were doing late night calls. The White House put together a group of, with the CDC, there was a rep from the NBA, a rep from the MLS, NFL, and Pac-12. We would talk weekly about things. The Pac-12, we did a really good, sweet thing. We all were on the same EMR, and so we were collecting the same data points. CDC used our data for a study and actually changed quarantine time based on some of the data that we collected. So I immersed myself back into this work, and I won. I mean, I beat cancer. In my mind, I'm still terminal. I still, go every 3 months to find out if I'm living or dying. But in my mind, getting back to a full life with my family and getting back to more than a full life in the work area means I won. Next slide. I think I'm getting close on time, but some of the things that the journey taught me is what strength really is. There was a gym I belonged to that really was my refuge, and I always find it funny when the people are filming themselves lifting, or the guys in the mirror in the restroom flexing, and I find that funny, because that's not strength. Strength is the person that you see at the gym that you know is sick, and just to be present, for them to show up, takes more strength than most people ever know. There was a lady that came to the gym, and I just walked up to her and gave her a hug. She lost her hair, and started talking to her about how I admired her. Turns out she had alopecia. Bit of an awkward conversation, but yeah. So they get offended when you come up to them like that and assume they're going through chemo. We all carry a flame, right? We all carry something that we're passionate about, and a diagnosis can't kill that flame. Only you get to decide how bright that flame burns, the color of that flame, and the intensity of that flame. So when you're in something that you feel like you don't have any control, you have more control than you realize. I've started to really change what I do. I'm going to eventually step aside from sports, and I'm focusing on working with cancer patients, and that's something that I think is important for everybody to understand. I do think that as ATCs, we have an incredible seat to people that do amazing things and come back from some really terrible situations. We need role models, and it turns out I used one or several of our athletes as a role model. To them, a devastating knee injury when you think you're going to the NFL can be just like a cancer diagnosis, and to see how they respond is really inspiring. You need to appreciate your caregivers often. It's harder for them. Your disease is harder for them because they can't really do much, and all they want to do is help. And then I think that we should all strive to be better and understand opportunities that make us better. Anybody have any questions? Thank you for the opportunity to share my story with you.